Ballot item number 5, Order M141, second reading of Bill 141, an act to require research to be undertaken and programs to be developed for pregnancy loss and infant death, and to proclaim October 15th as Pregnancy and Infant Loss Awareness Day. Mr. Colle.
Pleased to recognize the member for Eglinton-Lawrence.
Thank you, Mr. Speaker. I move second reading of Bill 141, an act to require research to be undertaken and programs to be developed for pregnancy loss and infant death, and to proclaim October 15th as Pregnancy and Infant Loss Awareness Day.
Mr. Colle has moved second reading of Bill 141, an act to require research to be undertaken and programs to be developed for pregnancy loss and infant death, and to proclaim October the 15th as Pregnancy and Infant Loss Awareness Day. Pursuant to Standing Order 98, the member has 12 minutes for his presentation. And again, I recognize the member for Eglinton-Lawrence.
Oh, thank you, Mr. Speaker. And I'd like to mention that my granddaughter Poppy is here, and my daughter Bianca, and my son-in-law Scott Goss, all the way from Belleville, is here, and my wife Sharon is here. Welcome. This bill is a bill that really I didn't want to do. Usually you want to do things, but this is one, sometimes you have to do things that, need to be done. I just want to read from an article written by Ashley Cassandi from the National Post a couple days ago. I think she sums up what this bill is all about. About 37,000 soon-to-be parents lose their baby along the way each year in Ontario, and as many as 1 in 3 women will lose a pregnancy in her lifetime. Many of them struggle with a system that often lacks support and training, as well as families, friends, and even healthcare providers who don't know what to say or do. Then their grief is compounded by lack of answers and insufficient research to provide for them. This is something that most of us, most people in this province probably do not want to talk about. And it is something that happens to thousands of Ontario families, mothers, every year. They lose children through miscarriages, stillbirths, or immediately after birth. And when that happens, what they run across is almost like a 2-tier healthcare system in this province and across Canada. So if you're fortunate enough to have the birth of a wonderful baby, you get the full and the best healthcare and support there is. If you happen to be unfortunate with a loss of a baby, all of a sudden you are treated totally different. There isn't the help, the support, medical or post experience to give you the counseling you need for yourself, the family. It isn't there. It's very haphazard. If you happen to be lucky and be in some of our excellent hospitals, Mount Sinai or Sunnybrook, there are great teams of expert doctors there and nurses and nurse practitioners that will help you through this traumatic time. But in most cases, like we had a young mother, a very brave young mother, who came to speak at the press conference the other day, Jamie McCleary, and she said it was just one of the worst experiences of her life to see her unborn child treated like medical waste. Nobody knew what to do with this dead child of hers. So you can imagine the trauma of this mother who's carried this baby for all these months, and this baby is basically treated, as I said, like medical waste. The problem is that it's sort of a cultural taboo. We don't like to talk about it. We can't talk about it. It's so difficult for mothers and families and fathers. So therefore, it's never brought to the public realm. So the public knows very little about this trauma that mothers and families go through. You know, mothers told me they go to the hospital and the doctors or a nurse or friends will say, well, you lost that one, but go ahead, try again, have another one. No counseling, no sympathy, and it's something you can't talk about because it's something supposedly you're not supposed to talk about. Subsequently, the counseling support afterwards is not there. The way babies are treated if they're not successful in their birth is really a hit and miss thing that is really disgraceful. So I know I've talked about some of these things to various experts, and they all agree we need to start breaking the silence. There's a Berlin Wall of silence around infant loss and pregnancy. Whether you're in the medical community or whether you're in the general population or in the Ministry of Health, it's a subject rarely dealt with. Subsequently, it doesn't get the attention, the resources that it desperately needs. And thankfully, most of the doctors that I have talked to in recent days, some of they're world experts. We're very fortunate. They all say we need this attention. We need to talk about it. We need to invest. We need to expand existing programs. And we need to acknowledge this is a health issue that can no longer be ignored. And I know I talked to Dr. John Kingdom here, the head of obstetrics and maternal health at Mount Sinai. He totally agrees. We have to pay attention to this so that we can get mothers and families the medical support that they need when they go through childbirth and pregnancy. These are things that can be done. We have the ability, but because of this, as I said, wall of silence, it's not given the attention, the resources it requires. There is a network called PALE, Pregnancy and Infant Loss Network, where a lot of volunteers go forward and talk to grieving mothers and families, give them some support. But this is a very small fledgling organization of volunteers that's standing alone in trying to give help to these mothers and families. We need to invest in these types of organizations and have programs right across the province of Ontario. Right now, as I said, it's very hit and miss. And these organizations, by the way, helping mothers and families quietly, are all over Ontario. They're in Brampton, Hamilton, London, Peterborough, Toronto, Markham, Durham, Barrie, Woodstock, Sarnia, Renfrew County, Ottawa. But they're working with limited resources, and they need to be resourced, along with the coordination of expert medical support, which is possible because we do have the experts here in Toronto, and we have experts in other parts of the province, but we need to coordinate them. There is an urgent need to do this because the experts even say, like Dr. Kingdom says, despite all the advances in medical science, the rate of infant loss and death has not decreased in this province. It's still on the rise every year. Thousands of mothers are going, and the research can't really tell us why this happens. And does this occur more in Ontario than it does in New York State or in Europe? We don't know. This comprehensive type research of the causes and the incident is not really done because we need to fund this kind of research and coordinate this research across the province, and we can do it with the expert doctors that we have here and nurses. Like we have a wonderful nurse practitioner who came to the press conference the other day, and she came to the press conference and she operates, I should say operates, she is the coordinator of this outreach program out of Sunnybrook, Wendy Molesdale. And she does this every day. And she says, I believe this bill is an important step to begin collaborating with the Ministry of Health and Long-Term Care. Together we can share our knowledge. We have to do better. Dr. Matthew Surmer from Mount Sinai says again, we need this kind of legislation. Dr. Seward from Mount Sinai got a letter from a doctor from Sunnybrook this morning saying we need this kind of coordination. So we have capable nurses, we have capable midwives, we've got an excellent healthcare system, but there's a big gap in our healthcare system when it comes to mothers that lose their children through miscarriage and stillbirth or early infant death. They just suffer in silence. They can't talk to their relatives because it's something you don't talk about. Sometimes their family doctors don't know anything about the grief they're going through. Some of them suffer serious mental challenges because of this tragedy they go through. So it can affect your mental health, your physical health, and not to mention the agony of losing a child that they've carried for months. So what this bill would do is basically help bring, and what we're here for today, I think, is with your support, we can bring attention to this subject nobody wants to talk about. We need to start getting people to ask questions, to discuss solutions, share best practices. So that's the essence of this bill, is to try and bring this out of the darkness into the front of our healthcare system. And at the same time, I'm also asking this bill that in order to help this awareness, as you know, we've done this with many bills in this House, Mr. Speaker, we've had awareness days. So I'm asking for October 15th, which is a day in many other jurisdictions, that we can call that Pregnancy and Infant Loss Awareness Day. So that would help too. So it's not going to solve all these problems overnight, because some of these, many of you have known, have been talked about quietly for years, but very little has been done about it, except, again, in isolated circumstances where you've got wonderful doctors and midwives who do something about it. There are programs, as I said, at Mount Sinai, Sunnybrook, but we need to have this available to all mothers and families across Ontario to see what practices, what protocols exist in Cornwall or Kenora, North Bay, in Burlington. We've got to know what's there for mothers there. Right now, it is not a comprehensive healthcare system. As I said before, it's a two-tier healthcare approach that exists in this province, and it's not to blame anybody, the doctors, or blame the people in the Ministry of Health. It's something that needs to change culturally. We need a change in our culture here towards pregnancy and infant loss, and this bill hopefully will move this along to where it should be. Thank you, Mr. Speaker.
Thank you very much. Further debate? Please recognize the member for Niagara West Glanbrook.
Well, thank you very much, Speaker, and I want to commend the member for Eglinton-Lawrence on this very worthy and compassionate initiative before the legislature today. And it makes a lot of outstanding points and tells some heart-wrenching stories. Yeah, I got to think the worst thing ever in life is you have to bury a child. Can't imagine that. You'd never wish that on your worst enemy. Sadly, this Saturday I'm going to a funeral for a friend of the family, been a good supporter, businessman, leader. His mom will be burying him. He lived to his 50s. Tom Fleming. Poor Val lost both Tom and her husband Art within a year. But it's a celebration of life, too, and a celebration of what Tom accomplished. And whether you lose a child as an adult, a teen, a youngster, we have ways of coping with that. Never makes up for the loss. But we have ways of families coming together to give support. But the member for Eglinton-Lawrence points out, it doesn't exist for children who are stillborn or miscarriages. We haven't developed, and I don't quite understand why. He says it's been taboo, which is true. And I always found it interesting when Deb and I went through her pregnancies and friends. You just don't tell anybody. What's the unwritten rule? 3 months or something like that. You're not supposed to tell anybody. Just the way it is. And It's kind of puzzling because it probably should, and it'll help us cope with that kind of loss. And as a result of that, without these coping mechanisms, a way of people giving the kind of support, family, friends, healthcare professionals, you feel abandoned and awfully empty. I guess you go through the, if you're stillborn too, my God, you go through the same gut-wrenching, extraordinary physical stress as the mom. The child's born, you've got that as the end product, a healthy baby. But if for a stillborn, it's that crushing emptiness that would result from that. And as the member said, people will often say, well, go back at it, you're young. There's really no way to deal with this. So members have a number of initiatives to deal with this in terms of looking at best practices, comparing scientific data, investing in counseling. I think those are all very worthy and timely initiatives. I think the other aspect too, I know I'm sharing my time with my colleague from Thornhill, but you beat yourself up too, right? Without some answers and some help and support, you start beating yourself up when this tragedy hits a family. We're lucky, Speaker, we have two beautiful little girls, Miller and Maitland, 6 years apart. Miller just turned 8 at the beginning of October. Maitland will be almost 2 for Christmas time. She'll be 2 in March. So good luck at the back ends. Some tough luck in the middle. But we got 2. But in these situations, I know the mind will whirl, right? What could I have done better? Should I have made some different approach on my own health? Did I exert myself too much? Dads will think this. But the moms, it's going to be deeply wired in. And if you don't have some better answers, some better practices, some counseling, that's going to haunt you forever. You start blaming yourself. I suspect that's some of the psychology behind all of this. But if, when a stillborn birth occurs or miscarriage, there's a better understanding of the science, there's some emotional support from family, from friends, of others that have gone through it, there's an understanding of the psychological counseling that can help make, I can't say adjustment, but help to cope, Speaker. I think we're going to be all a lot better off for it. So I commend the member. I think this is forward-looking. I had never questioned before why there is that 3-month taboo. There really isn't a reason for it. And for all those that go through that gut-wrenching loss and emptiness, it's going to help. So good for the member, Speaker. We're the initiative. Please support it. Thank you.
Thank you very much. Thank you. Further debate, the member for Hamilton Mountain.
Thank you, Speaker. I'm pleased to speak to this bill, an act to require research to be undertaken and programs to be developed for pregnancy, loss and infant death, and to proclaim October 14th as Pregnancy and Infant Loss Awareness Day. I thank the member for Eglinton-Lawrence for bringing it forward. Losing a child is an unimaginable pain, whether that loss is at infancy, at birth, or before term. It leaves a parent missing a piece of something so precious that should have been. A loss of a dream and the joy that was felt when they learned that they were bringing a new life into our world, and the thoughts of the possibilities that the future held. A family close to me was touched by such a loss at full term. It was a horrendous time. The nursery was ready, the shower had happened, everyone was excited and waiting for this wonderful gift that would be joining their family. But that excitement came crashing down as things went horribly wrong very quickly, leaving extreme emotional destruction in its path. This is just one experience that I'm very familiar with. The Pregnancy and Infant Loss Network reports that 1 in 5 pregnancies in Canada end in miscarriage, and that in Canada, 6 of every 1,000 births are stillborn. 37,000 families across Ontario experience pregnancy and infancy loss each year. Those parents deserve and require support and understanding during their time of grief. And that is what this bill aims to do. By amending the Ministry of Health and Long-Term Care Act, this bill would add new duties and functions to the minister. In addition to those duties and functions already in place, passage of this bill would require the minister to establish research initiatives and programs, undertake analysis to look and understand what contributes to pregnancy loss and infant death, develop programs to reduce the risk, provide counseling and support to families affected by these tragedies, and undertake research into the best practices of other jurisdictions. It's hard to argue against the Minister of Health being required to put all of these items in place, and I wouldn't want to do that. They are all needed. And there are many things that the minister should be required to do when it comes to the delivery of health care in Ontario. The lack of services for people with mental health problems has been spoken about often in this chamber. Earlier this year, I was taken on a tour of a few homes operated by the Good Shepherd in Hamilton, a transitional house where youth between 16 and 20, some of them dealing with mental health issues, learn life experience and skills and learn how to cope. A residential home for youth and supporting families who need support and tools to keep them to deal with their mental health problems, trauma, and conflict resolution. A shelter for homeless and street-involved youth, which provides 20 beds as well as on-site access to mental health professionals, a physician, a nurse practitioner, as well as youth support workers. Thanks to the dedicated staff of those workers and their own fundraising efforts, they manage all of this with government funding of $44 per day. They're terribly underfunded, and in fact, they have 1.6 mental health clinicians to service all of Hamilton. Children's Mental Health Ontario reports that 6,000 kids are waiting a year for mental health. We hear often of cuts to our mental health services as well as other health care. I hear it regularly from constituents. The member from Nickel Belt has spoken about the loss of 87,000 hours of nursing care in Health Sciences North. I appreciate what the member of Eglinton-Lawrence is trying to do with this bill, and I support him in this cause. Pregnancy loss and infant death is an exceptionally traumatic experience that does not get the attention that it deserves. Dee Ferguson is quoted on the Pregnancy and Infant Loss Network's website as saying, and I'll quote, "How very softly you tiptoed into my world, almost silently. Only a moment you stayed, but what an imprint your footprints have left on my heart," end of quote. It's very easy to underestimate the impact these events can have on mothers, fathers, and the entire family, but I think this quote really brings it home. This bill also serves as a reminder of where the government is failing to provide services right across the entire mental health sector. The bill will also establish October 15th each year as Pregnancy and Infant Loss Awareness Day in Ontario. This date is already recognized in the US, parts of Canada, Australia, the UK, and it was previously brought forward to this chamber by my colleague, the member for Hamilton East Stony Creek. I think it's fitting that we make this declaration now in Ontario. Again, I thank the member from Eglinton-Lawrence for bringing this bill forward and hope that we can pass it through committee and make sure we get this work done.
Thank you very much. Further debate, the member for Trinity-Spadina.
Thank you, Mr. Chair. I'm very pleased to rise and debate this very important bill brought forward by the member from Eglinton-Lawrence, named the Pregnancy and Infant Loss Awareness, Research and Care Act 2015. I noticed that there has been quite a bit of attention given to this bill since being introduced recently. And other than the coverage on media, I actually received emails from my constituency. Constituents felt passionately about this bill, and they urged me to support this bill. And I would like to quote one of the emails. Reads as, "Losing a baby is very traumatic for a family. It goes against the nature order of things. It can leave families feeling isolated and alone. These families are grieving and need access to support and resources. Support and resources which are sorely lacking today." And which brings me to my memory of my fond memory of having first having my two kids 7 years ago when my daughter was first born at Mount Sinai, which is a wonderful facility situated in my riding. There were entire wraparound service around my wife, the mother, and the newborn. I remember there was specifically on postpartum depression, and the mother was cared for that. And I felt, wow, this is what I've never experienced this before. Similar experience when my son was born, Matthew, was born 2 years after. So I'm a little surprised by the lack of service or support in place for those who lose infant babies or had a miscarriage. And to me, I think they probably go through even greater chance of emotional distress. So I fully support this bill. I think it speaks to some of the gap in service, and if passed, it would establish and expand comprehensive research initiatives and programs to assist mothers and families who experience pregnancy loss and infant death, undertaking a comprehensive comparative analysis to understand the factor that contribute to an increased risk of pregnancy loss or infant death. This is very important because this day and age, we all have Blackberries and cell phones. Everyone's working on their laptop. You'll think that collection of data is so easy, but yet we're still dealing with an area where limited data is available for any analysis, for the ministry even look at it and make some policy around it. So I think this bill does just that. It actually shed a light and call out the need for more data collection, more attention paid in this area. And the member from Eglinton-Lawrence gave us some good numbers on good stats on infant loss in the past. And I think it is time for the province and for this government to take a look at what we can do to provide that very much needed support. And it also speaks to develop and expand programs to help reduce the risk of pregnancy loss and infant death. Develop and expand existing programs across Ontario to provide counseling and support to mothers and families who have experienced a pregnancy loss or infant death. Now, I said I can only imagine a parent going through losing a child because it's any time you lose a family member, you need time to grieve and you remember the good times you have with this family member. In this case, it'd be very difficult because I can only imagine the parent going back home and seeing the room prepared for the newborn, everything, and start to wonder what would be like. They can only imagine what could be like as opposed to remember those fond moments. So I think the support has to be there to these mothers and father as well to go through the very, very tough period of time. You also suggest to undertake a comprehensive analysis and survey of the best practice in other jurisdictions in regards to prevention of pregnancy loss or infant death. We have to look around the world and see how other places are dealing with this issue. And I think that if we put our minds and resource in this, we could be a leader in this area. Now, I just had recently visit China, and they're envy of our biomedical science and the way that we manage our medical system here. And I think if we start paying attention to this area, we could be the leader in this area and provide further assistance, not just to Ontarians, but outside Ontario and even the world. So I'm fully supporting this bill, and I want to thank the member for bringing it forward, and look forward to further discussion on this bill. Thank you, Mr. Speaker.
Thank you very much. Further debate, the member for Thornhill.
Thank you very much, Mr. Speaker. Once again, I'm apologizing for my raspy voice today. Of course, this is something that we should be discussing here, because we're the ones who set an example for all of Ontario. And I'm reminded of sort of the difference in culture if a woman has been raped, that it wasn't that long ago that nobody would want to admit they were raped. Certainly parents didn't want people to know their daughter had been raped. They felt that nobody would want to associate with her or possibly marry her. And it was also a huge taboo. And we went from that to much more openness, not enough, but much more openness, but certainly in the medical field, where doctors will even ask women now, when they're doing a case history or seeing a woman for the first time, they'll even ask sometimes, you know, have you ever experienced any, you know, traumas of a sexual nature? They'll ask it sort of in leading terms. But I don't think doctors will necessarily ask a woman if they've ever miscarried a child or you know, things like that, unless she's trying to get pregnant. Then they sort of want to know the case history and want to know if it's an at-risk pregnancy. But there are special rooms, in emergency rooms in all our hospitals, for women who've been raped, with special information and set aside. And you would hope that the hospitals would be much more understanding, but I have a feeling that they're not, Mr. Speaker, because they're under incredible budgetary strain to separate a woman who's given birth to a stillborn child from the other women who've given birth to healthy children. That you could just imagine the mother still needs the same health care delivery as a woman who's delivered a healthy child. She still delivered a baby, there could still be complications, and she still needs to be taken care of. And we would hope, Mr. Speaker, that the resources can be put in place and that we could do something to ensure that the resources are in place if they're not in place everywhere. I'm going to just say a little bit about my culture and the Jewish culture. Not everybody follows it, of course, but basically you're not pregnant until you're past your first term, because it was the understanding that so many women miscarried in that first trimester that you wouldn't tell people that you were even pregnant, and if people would even ask you, would sort of say, well, it's not 3 months yet, so we're not even going to talk about it. Certainly observant families and even many secular Jewish families, they won't hold baby showers, they won't decorate the nursery, they'll order it. It's sort of like a registry when you're getting married and you order dishes and things like that, that they'll order everything, they'll have everything ready to be delivered, and they'll have a relative or friend at the house to have everything delivered when the woman is in the hospital and they get the phone call that everything's okay. Because it's tragedy, obviously, if a baby does not survive the birth or has some kind of medical complications that doesn't live very long. But that tragedy is exacerbated by the mother and father having to come home to see all the clothes and nursery set up and everything set up. Of course, it's not always practical, and my father always talks about how, you know, my mother wouldn't want to have anything in the house, and she had 4 children, and he would be left scrambling because he'd have to go and, you know, get everything, especially for the first child. She didn't have anything, and he said, I'm bringing a woman home with a baby. Of course, in those days, they kept you in the hospital for a week, so that left all your relatives time to repair things at home for you. My mother had a little brother when she was about 4 years old who had a hole in his heart today that would be easily repairable. But my grandparents were told there's nothing we can do. He's going to die in 2 weeks, and you shouldn't bring him home. You know, this way, just tell people he died, and we'll just take care of it from here on. Well, my grandmother wouldn't hear of that. She took the baby home, and he lived for 2 weeks. And because he hadn't been circumcised yet, he couldn't have a proper burial. So my grandfather had to take a shovel and bury him. So it's really heartbreaking. I never talk about it, but it is very heartbreaking. Sorry, between my hoarse voice and I'm choked up, it's not a good combination. We all know of somebody who's lost a baby from SIDS, from sudden infant death syndrome, and the famous, oh, thank you so much, sweetie. It's okay, thanks. Very sweet. That, you know, celebrity Marla Shapiro, Dr. Marla Shapiro in Toronto, became a spokesperson because she was interviewed. She lost one of her children to sudden infant death syndrome, and she went on to have a career, basically, in the public forum, speaking out not just about that, but about women's health advocacy and just general, became a TV spokesperson on City TV. She's a regular. She got her own, ended up with her own talk show on health issues. And I think that was a very brave thing for her to do, because when she did it, very few people were able to, like, I'm not even able to talk about somebody I never even met, but to go on TV and in the public forum, and she helped so many people by doing that. So kudos to her and for all the great work that she's done. And I think that our healthcare professionals are programmed and trained to deal with healthy babies. And they're uncomfortable as well when, and they just want to see it end, because it's painful for them as well. And you can certainly imagine the healthcare staff having to spend the hours and getting to know the parents, only to not have the child survive the delivery. So, of course, we all want to do what we can to raise awareness. Thank you very much, Mr. Speaker.
Thank you very much. Further debate. The member for London West.
Thank you very much, Speaker. I also want to thank the member for Eglinton-Lawrence for bringing forward this bill, the Pregnancy and Infant Loss Awareness, Research and Care Act. This is certainly an initiative that the NDP fully supports, and in fact, my colleague, the MPP for Hamilton East Stony Creek, had introduced a similar bill in 2010. As women's issues critic for the NDP caucus, I want to frame my comments from the perspective of reproductive justice. Reproductive justice acknowledges that not all women have the same ability to make reproductive choices. Their reproductive autonomy may be limited by lack of access to abortion services or by lack of social and financial resources that are necessary to have children and to raise them in safe and supportive environments. So this bill recognizes that pregnancy loss must equally be included in the full spectrum of pregnancy and parenting options that reproductive justice includes. So that covers abortion, IVF, childbirth, adoption, and now pregnancy loss. I want to speak for a moment about language. Certainly language evolves, and I congratulate the member for the language of this bill, because what we see here is a long overdue step forward from the term miscarriage, which is how we often refer to natural pregnancy loss. But what the term miscarriage conveys is that there is some fault or blame involved in the loss of the pregnancy, when actually the physicians will tell us that pregnancy loss is most often the physiology of a healthy body recognizing that a pregnancy is incompatible with life. Unfortunately, Speaker, too many people do not understand the causes of miscarriage. There was a study by the American Society for Reproductive Medicine that found 3/4 of both men and women believe that stress can cause miscarriage. 2/3 believe that lifting a heavy object could trigger the loss of a pregnancy, and 1/4 believed that miscarriage could be caused solely by the woman not wanting the pregnancy. The reality is that most miscarriages are not associated with any action or inaction on the part of the woman. Most are caused by spontaneous chromosomal anomalies that make human development impossible. They also occur, as the member said, much more frequently than many people realize. Women who know they are pregnant experience a rate of miscarriage of about 1 in 5 or 20%, but the rate is much, much higher if it includes the loss of fertilized eggs before the woman knows that she is pregnant. But because of misinformation about the causes of pregnancy loss, many women feel shame and stigma if they admit experiencing a loss of pregnancy. We have a society that values the worth of women according to their ability, their desire, and their willingness to carry a pregnancy to term and to raise children. So it's no wonder, Speaker, that women often blame themselves. So by talking openly and honestly about pregnancy loss, which is what this bill does, by talking about the incidence of pregnancy loss and what can happen afterwards, we can reduce the stigma and the guilt that often accompanies pregnancy loss. Speaker, we need to ensure that there are appropriate supports in place to help those who experience pregnancy loss, not only the women, but also the woman's partner and others who cared about the pregnancy. There may be feelings of profound grief at the loss of hopes and plans for a relationship with a child and the loss of future identity as a mother, as a father, or as a grandparent. At the same time, reproductive justice requires that we recognize and respect that there may be differences in responses to pregnancy loss. We have to avoid assuming that all individuals will experience the loss in the same way and will need the same kinds of support. We have to remember that the social norms of masculinity and femininity that condition women's response to pregnancy loss have an equal impact on men, who are expected to be stoic and strong in their handling of grief and may actually face disapproval if they display emotion. For pregnant women who have been abused by their intimate partner, and we know that the risks of violence to women increase significantly during pregnancy. We know that the World Health Organization found that spousal abuse increases the risk of miscarriage by 50%. So women who experience pregnancy loss as a result of sexual violence require very specialized counseling and supports to deal with the complex emotions that are associated with the loss of the pregnancy. Before I close, Speaker, I just wanted to go back to what I had said in the beginning about the full spectrum of pregnancy and birth options for women. There is a link between pregnancy loss and abortion. When the fetus dies, a D&C is often required to fully end the pregnancy, and this means that comprehensive access to abortion services are vital across this province, not only to protect women's reproductive autonomy, but also to support women through the loss of the pregnancy. So, Speaker, again, I want to congratulate the member for bringing forward this bill. On behalf of my colleagues in the NDP caucus, we believe that this is an initiative that is important and that should go forward as part of our healthcare system and the kinds of supports that we provide to women and men and families in this province. Thank you, Speaker.
Thank you very much. Further debate, the member for Burlington.
Thank you, Mr. Speaker. It's always a pleasure to stand in the House and speak to important issues, Speaker. And I have to say, joining my colleagues from London West, Niagara, West Glanbrook, Trinity-Spadina, Hamilton Mountain, it's a very powerful personal reflection, Speaker. Today, I always love Private Members Hour. It gives us a chance to talk about issues of mutual interest and concern, but today is particularly important, and I want to thank, in that regard, my colleague from Eglinton-Lawrence for tabling this conversation today, Speaker, by bringing forward this bill, 141, the Pregnancy and Infant Loss Research and Support Act. I want to thank him because this is an important conversation for us to have, not in a finger-pointing kind of way, but in a let's embrace the survivors of loss, and let's do that in a compassionate and empathetic way. This bill, this conversation, addresses an issue that is often underreported, and one which we in Ontario and across the country often have a hard time talking about, and yet it is an issue which touches so many lives, one that has touched, I am sure, Mr. Speaker, virtually all of the members in this House, and sadly it has touched me and my family personally. The expected birth of a child is supposed to be one of the happiest moments in one's life, a time full of excitement and wonder and ultimately hope for the future, and far too often these magical moments are cut short by unexpected events. There is no reason for this subject to remain a taboo, and that is exactly why today's debate is so important. Because especially here in Ontario, we are proud of our ability to speak openly about the issues that impact our lives. That is why I'm pleased to say that if passed, this bill will proclaim October 15th as Pregnancy and Infant Loss Awareness Day in Ontario. Sometimes one of the most powerful and important things you can do to affect change is to simply raise awareness about an issue, and this bill will certainly do just that. Of course, awareness itself is not enough. We need to deal with the complexities that lie at the heart of issues relating to pregnancy loss and infant death. Individuals who go through these extremely trying experiences need a range of supports to help them cope and to assist them in their recovery. Because each individual and family's experience is unique, there is no one-size-fits-all approach to providing support when it's needed most. That's why, importantly, this bill calls for development and expansion of existing programs across Ontario to provide counselling and support to mothers and their families who have experienced pregnancy loss or infant death, in addition to calling for more research into the prevention and understanding of these issues. An evidence-based approach is needed to help mothers, fathers, and their families, and all of their loved ones indeed, when they need it most, to heal their wounds, both seen and unseen. According to a study conducted by the University of Rochester and published in the British Journal of Psychiatry, the depression and anxiety experienced by many women after a miscarriage can continue for years, even after the birth of another child. Sadly, we hear stories of survivors who've lived experience of loss simply isn't being validated or supported. For example, mothers are told that they will be fine once they have a healthy baby, when the research demonstrates that this is simply not true. Of the women who've had one miscarriage or stillbirth before giving birth to a healthy child, for example, almost 13% still had symptoms of depression 33 months after their new baby is born. Of those with 2 previous losses, almost 19% had symptoms of depression, again almost 3 years after the birth of a healthy child. That's close to 3 years, as I mentioned, of struggling to bear a burden that is to all of us inconceivable. As the member from Niagara West Glanbrook said in his remarks, and indeed, Speaker, in his extraordinarily personal remarks, no one should have to bury a child. This is completely outside the natural order. Prenatal loss is not routinely considered a risk factor for antenatal or postpartum depression, in the same way as, for example, personal or family history of depression or exposure to other of life's stresses. We need to change the way we need to think about this, the way that we think about this type of loss, and that is what this bill hopes to accomplish. It would recommend necessary targeted support because, as we know, maternal depression does not just affect mothers, but entire families. Speaker, it is our duty as public servants to support Ontarians who suffer such tremendous losses. Mr. Speaker, it's often said that it takes a village to raise a child, but when a child is lost, that village suffers profoundly. I commend my colleague, the member for Eglinton-Lawrence, for introducing a bill which would have long-standing positive impacts, not just for the women who have lost a child, but for their families and their circle of care too. I urge all members of this House to support this bill, because no one should feel like they're going through these incredibly difficult times alone without the necessary support. So let's make sure, Speaker, that they don't have to. Thank you very much.
Thank you. I now return to the member for Eglinton-Lawrence.
Thank you, Mr. Speaker. And I truly want to thank the members that spoke. It certainly brought out the best, and I thank our members here. The member from Niagara West Glanbrook, and he said very eloquently, you know, we don't want these thousands of Ontario women to feel abandoned, and they are right now. They are abandoned. There is no help, basically. So you lose a child, there's no medical help, there's no counseling support, there's no family help. They are abandoned. And that's why there's an imperative for us as legislators to move our government, our province, our society to stop this. We can't continue to see mothers left to suffer because, as the member from London West said, of biological chromosomal activity. This is what's happening. They're discriminating. As I said, there's a two-tier healthcare system that punishes hundreds of thousands of people. They get punished because they had this misfortune. They get punished twice. They lose that child, then they have no one to help them when they go home. And I thank the member from Thornhill for talking about her grandmother and the, you know, these are the things we never talk about, but the courage you had in speaking about it, I thank you for doing that. And I want to thank all the courageous women who's been helping with this fight. Michelle LaFontaine, who's the chair of the PALE Network. Wendy Mosdale, who's a pediatric nurse practitioner who's here from Sunnybrook. Jamie McCleary, a very brave mother from the PALE Network. You know, Dr. Kingdom, all these brave people who are speaking out, because up until now you weren't allowed to speak about this. So it's time to take some action, and I'm committed to doing what I can through this bill to do, as the member from Burlington said, more than awareness. We need to change things in this province to get rid of this discrimination and this punishment of women that happens every day. And it's not by the hundreds, it's by the thousands. Women are being punished and families are being denied the support they need. This has got to end.
Thank everybody for their comments. The time provided for private members' public business has expired. We will deal first with ballot item number 3, standing in the name of Madame Gelina. Madame Gelina has moved second reading of Bill 104, an act to establish the Université de l'Ontario Français. Is it the pleasure of the House that the motion carry? I declare the motion carried.
Second reading of the bill, deuxième lecture du projet de loi.
Where's my green sheet? Oh, it's not here. It didn't? No, it's okay. Pursuant to Standing Order 98J, the bill is being referred to Madame Gelina.
Committee on Social Policy, please.
Requested to be referred to Committee on Social Policy. Agreed? So moved. Mr. Sattler has moved second reading of Bill 142, an act to amend the Children's Law Reform Act with respect to the relationship between a child and the child's grandparents. Is it the pleasure of the House that the motion carry? I declare the motion carried.
Second reading of the bill, deuxième lecture projet de loi.
Pursuant to Standing Order 98J, the bill is being referred to
General Government, please.
Member has requested it be referred to General Government. Agreed? Agreed. Mr. Colle has moved second reading of Bill 141, an act to require research to be undertaken and programs to be developed for pregnancy loss and infant death, and to proclaim October 15th as Pregnancy and Infant Loss Awareness Day. Is it the pleasure of the House that the motion carry? I declare the motion carried.
Second reading of the bill, deuxième lecture projet de loi.
Pursuant to Standing Order 98J, the bill is being referred to. Mr. Colle.
I move the bill to committee dealing with private bills.
And the member is requested to be referred to the Committee on Private Bills. Agreed? Agreed. Orders of the day.